Now let us talk about the attachments on the shaft. The entirety of the upper 3/4 of the anterior and the lateral surfaces of the shaft gets the attachment of vastus intermedius. Just below the attachment of vastus intermedius is the attachment of articularis genu. The lower 5 centimeters of the anterior surface is related to the suprapatellar bursa. The medial surface and the patellar surface of the femur, they are bare and they do not get any attachment. This was the intertrochanteric line. The upper part of the intertrochanteric line gets the attachment of vastus lateralis. It moves backwards and laterally along the anterior and the inferior aspects of the greater trochanter. Then it moves onto the lateral margin of the gluteal tuberosity and the upper half of the lateral lip of the linea aspera. The lower part gets attachment of vastus medialis. It arises from the lower part of the intertrochanteric line. It spirals along the spiral line, moves towards the medial lip of the vastus medialis and goes onto the medial supracondylar line. The deeper fibers of the gluteus maximus are inserted into the gluteal tuberosity. The adductor longus is inserted onto the medial lip of the linea aspera next to the vastus medialis. Adductor brevis is inserted into a line extending from the lesser trochanter of the femur towards the linea aspera. Next to it is the pectineus, which is also inserted on a line extending from the lesser trochanter towards the linea aspera. Adductor magnus is inserted onto the medial margin of the gluteal tuberosity. It moves downwards onto the medial lip of the linea aspera and the medial supracondylar line till the adductor tubercle. The short head of biceps femoris arises from the lateral lip of the linea aspera between the vastus lateralis and the adductor magnus and from the upper 2/3 of the lateral supracondylar line. The medial and lateral intermuscular septums are also inserted onto the linea aspera and to the supracondylar lines. The lower end of the lateral supracondylar line gives origin to the plantaris above and lower part gives origin to the lateral head of the gastrocnemius. Popliteal surface is covered with fat and forms a floor of popliteal fossa. The medial head of the gastrocnemius arises from the medial supracondylar ridge and extends onto the patellar surface. Now, if we look at the lower end of the femur, we can see that it is widely expanded to form two large condyles. If we look at the upper end, this is the head of the femur. We are looking at the posterior aspect of the femur because of the presence of linea alba. So this becomes the medial epicondyle and this becomes the lateral epicondyle. These two large epicondyles are separated posteriorly by this fossa. This fossa is called the intercondylar fossa, present between the medial and the lateral epicondyle. If we move the shaft towards the anterior side, the two condyles are united and are almost in line with the anterior surface of the shaft. If you look at the posterior aspect, the two condyles are projected backwards and they are beyond the plane of the popliteal surface. Now we can see that the two condyles have an articular part. This, all of it, is the articular part of the two condyles, and it also has the non-articular parts. Now if we look at the articular parts anteriorly, the articular parts are almost joined together and posteriorly they are separated because the two condyles are separated. The anterior part is called the patellar surface and the posterior part is called the tibial surface, because anteriorly the femur articulates with the patella and inferiorly both of the condyles articulate with the tibia, and then they transmit the weight. The patellar surface covers the anterior surface of the lower end of femur and both condyles. It is extended more onto the lateral epicondyle than onto the medial condyle. Between these two condyles there is a vertical groove, and it is separated from the tibial surface by two faint grooves not visible in this specimen. The tibial surface covers the inferior as well as the posterior surfaces. That is, it covers the inferior as well as the posterior surfaces of the condyles. They merge anteriorly with the patellar surface and they part as the two condyles part because of the presence of intercondylar fossa. The tibial surface of we are looking at it, the lateral condyle is straighter and the tibial surface of the medial condyle is convex and longer. Now if we look at the non-articular surfaces, what we can see is from the posterior aspect, the lateral condyle is almost straighter and it is more in line with the lateral border as compared to the medial condyle, which is extending medially as compared with the medial border. The lateral condyle is more in line with the shaft and it therefore takes greater force transmission of the body weight to the tibia. This condyle is less prominent than the medial condyle, but it is stronger and stouter because of the weight transmission. The lateral aspect of the lateral condyle has a prominence which is called the lateral epicondyle. Below the lateral epicondyle there is a groove, and the posterosuperior part of the lateral epicondyle has some muscular impressions. The medial condyle also has a projection which is called the medial epicondyle, and the posterosuperior part is raised in the form of a tubercle. The intercondylar notch or the fossa separates the posterior part of the posterior and the lower parts of the two condyles. They are joined at the anterior side. It extends between the two condyles and it is separated from the patellar surface by this ridge which is called the intercondylar line. Now let us discuss the attachments onto the lower half of the shaft. This is the medial side, so we will talk about the medial condyle and the lateral condyle. The lateral condyle had the lateral epicondyle. This gets the attachment of fibular collateral ligament. Below the lateral epicondyle was the popliteal groove. It gets the attachment of popliteus muscle. The muscular impression behind the lateral epicondyle gets the attachment of the lateral head of gastrocnemius. On the medial condyle, the medial epicondyle gets the attachment of tibial collateral ligament. The adductor tubercle gets the attachment of adductor magnus. This intertrochantaric groove on the medial wall of the lateral epicondyle in its posterior part gets the attachment of anterior cruciate ligament. The lateral wall of the medial condyle in its anterior part gets the attachment of posterior cruciate ligament. The intercondylar line gets the attachment of oblique popliteal ligament and the capsular ligament. The synovial fold is joined onto the anterior end of the intercondylar groove. That's it. Thank you.